Our next interview is with the leaders of the new Discovery Project. And Dr. Savell, you were down the exhibit hall talking to the new research network. Any thoughts on that?
Thank you very much, Andrea. The Discovery Research Network is a really exciting, innovative collaborative in which it takes pre-existing critical care research networks and combines them with each other to help them be able to help critically ill patients and do the kind of critical care research that currently requires greater resources. They will be applying the resources of the Society of Critical Care Medicine, both in terms of financial support as well as other infrastructure. There's lots more to learn about it.
Excellent. Well, let's take a look at Dr. Savell's interview to learn more.
Hi everyone, Rich Savell here. Today, as part of SCCM Live, we're going to be talking about a new initiative from the Society of Critical Care Medicine known as Discovery. And I'd like to let you all introduce yourself.
Hi, I'm Ognjen Gajic. I'm an intensivist and clinical researcher at the Mayo Clinic.
Excellent.
And I have a privilege to have worked with Craig and colleagues over the past year in developing this exciting new opportunity, Discovery Clinical Research Network.
Excellent. Dr.
And I'm
Coopersmith.
Craig Coopersmith. I'm an intensivist at Emory University and the outgoing immediate past president of SCCM.
Excellent. Well, as I was saying to you guys offline, I'm learning a little bit more about this, and I'd love to hear more from you. So, Dr. Coopersmith, I was going to let you comment, or perhaps to give a little bit of background about how this all came into being.
Yeah, so it's an incredibly exciting time for research at SCCM. This has been part of our strategic plan for a number of years, and it really culminated in this announcement with Ruth Kleinpell's presidential address today that we're spending $3.5 million over the next 5 years to form a research network, which is the largest outlay of money we've ever had in SCCM outside of our buying our own building. So we come into this with a tremendous amount of enthusiasm and excitement for patient-cared research and the infrastructure of our 16,000 members and our greater than 60 fantastic full-time professional staff. And this is emerging with our friends in USCIIT, where Ogi is the chair, and the tremendous work that they've done bringing in millions of dollars of grants, publishing in the highest possible impact journals such as JAMA and Critical Care Medicine. Actually, personally, my person on the right has done so, along with CCPTN, the Critical Care Pharmacotherapy Trials Network. So simplistically, SCCM starts with a tremendously large population, a tremendously large infrastructure, and a large willingness to outlay the biggest sum of money we've ever laid out for anything. And we bring it to two existing trials networks that clearly are world's leaders that already are doing fantastic work, but can go to even greater levels with more money and more resources and more infrastructure between us, and it's a marriage made in heaven.
Wow. How would this relate to grants that may be already funded at the federal level by NIH and things like that? What's the sort of big picture concept, or does it not fit in at all?
Of course it does. I mean, obviously, the bringing investigator-initiated research and researchers together with the infrastructure that SCCM provides, which is numbered by pilot. Some of this money will go to pilot grants, so initial proposal that will increase the chance of getting the larger amount of funding from the government agencies. Possibility for a centralized data and statistical coordinating center, central IRB peer review of the proposals. The excitement is really relating. Today we have a first investigator meeting as a joint group just today at 2 o'clock in Ala Moana Hotel, and within 1 month of this announcement, we had 7 new proposals that will be presented today.
Wow.
And we are hoping to operationalize the infrastructure and be able to support at least 1 or 2 of these proposals to be conducted over the next year, and maybe the results presented on the next 2018 critical care meeting.
And
it's really exciting in that we're going to be doing 2 things. We're going to be working with the premier investigators in the world, bringing in hundreds of thousands and hopefully millions of dollars of research money and really giving a larger playing field that we can play on, because we have 16,000 people and their closest friends to go to. And at the same time, Discovery will also be giving out grant money. We'll be giving out in a way that USCIIT and CCPTN have been unable to do in the past, but using SCCM's resources. So we will both be bringing in, hopefully, small, medium, and large size federal, foundational, et cetera, grants, and also we will be giving out money for the next generation of researchers to start their pilot projects to hopefully turn into the next Dr. Gajic.
And as you were describing to me before, because you're bringing together multiple pre-existing research entities, you might be able to have projects that go across multiple pre-existing research entities?
Absolutely, and we are really looking forward to collaborate within SCCM as well as with partner societies and partner clinical research networks. So today, the Australian and New Zealand critical care groups will be a guest speakers in our investigator meeting to see what we can do together.
It's really an honor for me to call you both friends and to be here with you, and I was just wondering if you wanted to make any sort of final concluding comments, either of you or both of you, regarding this new exciting initiative.
Well, I'll just say, again, it's a marriage made in heaven, and USCIIT for years, and CCPTN as well, has talked about being a network of networks, bringing together researchers of all stripes to work together. SCCM, in a similar fashion, is an international organization. And we saw this morning there are people here from 30 or 40 different countries, and we can bring together a network of networks and an international organization stronger together, not a political statement, but clearly our ability to reach the patients and their families are exponentially increased bilaterally, and ultimately they'll be the ones who win.
On behalf of Dr. Coopersmith and Dr. Gajic, my name is Rich Savell. Thanks so much for joining us here at the Society of Critical Care Medicine's 46th Critical Care Congress. Thank you.